Okay, so I thought by special request, no names mentioned, someone has requested that we cover asthma today, so that is what we're doing. For all my one viewers out there, that is what is going to happen. So, asthma is basically defined as airway obstruction caused by inflammation, etc. And the key to it is that it's reversible airway obstruction. So we can give medications to reverse that constriction and that inflammation. Okay, so this is what a normal bronchiole looks like in a healthy person. I hope that's what your bronchioles look like. And then here's what happens, as you can see, when you get some type of obstruction. So usually what happens is these are the smooth muscles here around the lining, and something triggers them to kind of replicate and contract. So it kind of causes a contraction, as you can see, and you can see from the replication that it's actually got thicker in size. Okay, and I assume that red stuff is supposed to be inflammation. And usually what happens is the immune cells release something called histamine, which you've probably heard of, and that causes swelling. So that's why antihistamines are useful in reducing swelling for people who have allergic reactions. So if your asthma is caused by an allergy, then antihistamines are really good for reducing the inflammation. So what I've done here is I've actually wrote some stuff out to kind of help you understand. So I wrote reversible airway obstruction, just kind of like the main points, because sometimes it's good to have something written down, even though it's written in green. You probably can't see it very well. I'll try to zoom in. If you can even read my handwriting, I think it's okay. So, yeah, so I mentioned reversible airway obstruction. That's key. And people are going to come to you, well, not to you, but people will come and complain of feeling breathless at night or at a specific time. The key to asthma is that it's intermittent. They don't have that breathlessness all the time. They also have a wheeze, tightness of the chest, these types of symptoms, usually worse at night. They'll also have a family history, perhaps. It's good to ask about all these things. And I'll touch on other stuff later, but for now we'll just talk about the actual muscle and the way it works. So the smooth muscle has a number of receptors on it. So you can probably see that says Mardi, and you're probably thinking, what the hell is that all about? Well, the name of the muscles or the receptors are the muscarinic receptor and the beta receptor. So salbutamol, which you've probably heard of, which is the blue inhaler, is a beta 2 agonist. Okay, so it's part of the beta, triggering the beta receptor. So in your smooth muscle, it can constrict and it can relax. And obviously if your muscle constricts, it's going to lead to this type of a thing. So you don't want your bronchioles to be constricting, okay? So the aim is that when you get these kind of cycle of events where you have inflammation and constriction of your bronchioles, the way to treat it is the first thing you want to do is reduce the inflammation, especially if it's a very severe asthma attack. For generalized asthma that people have, where they'll go home with inhalers and they'll be okay, a blue inhaler is enough. But if someone comes in for an emergency and they've got loads of inflammation in their bronchioles, they're going to need steroids given to them IV, which means in the vein, to reduce that inflammation quite rapidly, otherwise they won't be able to breathe. And here you can also see, I know I didn't cover alveoli, but I'll do that for you soon, inshallah. But basically, when air comes to the alveoli, which is where it goes normally when you breathe in, it can't come back out, so air's trapped in there. Because obviously, when you breathe in, remember when I mentioned last time, you breathe in and your bronchioles will increase in size because of the breathing in mechanism. That's a natural response. And then when you breathe out, they're going to be very narrow, so it's going to cause some air trapping, and it's also going to cause that wheeze that I've talked about. Okay, so the way to treat it is you either try to relax the muscle. So the beta receptor is responsible for relaxing. So a beta agonist is something that's going to induce that. So you're inducing relaxation, and that's how the salbutamol works. Works very well actually. Muscarinic receptor basically actually causes the constriction. So that's why I called it MADI, because it's not something you want. And it's probably going to make you pretty moody, especially in children, as you've already said with Samaya. But the muscarinic receptor blockers are a type of medication as well. So you can either block contraction or you can stimulate relaxation. Either way, the same effect is going to happen. In terms of the inflammation, you usually give steroids. You can have steroid inhalers, or you can actually have like oral steroids that you take, prednisolone. Depends on the severity of what's going on, really. But the brown inhaler is also a type of steroid. So what the brown inhaler does is a preventer. So it stays in your system, you usually take it at night, and it just helps keep inflammation away from your airways, especially during the night or whenever you're getting the symptoms the worst. So the blue inhaler is for effective relief. So it'll relax your bronchioles while you're having an attack. So you should only take the blue one when you need it. If you've got asthma, take the brown one, usually once a day. Should be enough to kind of just keep the inflammation away. The other thing I have mentioned here, so yeah, they're just the three things again. And then triggers, there's loads of triggers: pollen, dust, smoking, even exercise can cause it. Some people will go on a run and they'll start feeling breathless and wheezy. The best thing for them is to take your salbutamol before you start. That will keep your airways open and it'll help you during your exercise, etc. as well. So you may want to consider it when you start going up the stairs of death. Definitely something to consider for you. What else do we have here? Mites. I can't remember what I've written there. Pets. Yeah, pets can be a trigger. Pillows. Feathery pillows. You know, people might change pillows and all of a sudden get breathless more often. Triggers are a massive thing, and it's something that we need to try and identify when we take a history from a patient, because people will have moved house, they may be having renovation done, dust might be all around the house, a pet might have suddenly started becoming part of the family. You don't really know what's going to happen. Ignore the spicy thing. Well, don't ignore it. What's this spicy behavior you've been doing? GERD just means acid reflux. So gastroesophageal reflux disease. So gastro is stomach. Esophageal is your esophagus, which is your food pipe. Reflux is obviously the reflux of acid which comes up, and disease is the fact that it's a disease. So it's known as gastroesophageal reflux disease, also known as acid reflux. Some people call it heartburn. You obviously know the more technical term now, so I expect that from you. That can obviously cause irritation of the airway. Remember I said acid can come up and go into the airway, so that's what can cause constriction, inflammation. You can get asthma symptoms if you have acid reflux. So sleeping with extra pillows, I'm sure some of this you're familiar with already. Eating small portions, don't eat too late at night. That type of thing is very useful for people like that. Aspirin has been known to be, people have been known to be sensitive to aspirin. So some people may take aspirin and start getting symptoms. Usually if someone has asthma, it's not good for them to take NSAIDs, and they're your non-steroidal anti-inflammatory drugs like your ibuprofen, because they can trigger asthma symptoms. So some people are sensitive to these things. It's just good to be aware of what may be a trigger. Like someone might be taking ibuprofen and getting breathless. You might be telling them to stay off their triggers. So what else do I have? Diagnosis: wheeze, intermittent triggers. You do something called pulmonary function test, which is a different topic, which I won't go into too much. But what you basically do is there's a device known as a peak flow, which is what people breathe really hard and fast into. I'll find an image for you. You've probably seen it. You'll probably recognize it when you see it. So peak flow meter. So it looks something like that, and they'll breathe in as hard and fast as they can, and they'll get a reading. Okay, and what we do when we're trying to diagnose asthma is we'll give them salbutamol, and then we'll tell them to perform the test again. And if there's an increase by a certain amount that we measure, then the person's diagnosed with asthma. Because you have asthma if we can improve your airways by a certain amount by giving you salbutamol, then you know that there's some problem with your airways, if that makes sense. Also, the treatment is remove the triggers for a start, and then generally it's salbutamol, which is known as SABA, and short-acting beta agonist. So you know about beta agonists now because I mentioned that here. So it's a short-acting, and it just kind of relaxes your airways. And you also give steroids as well. You give the brown inhaler. Usually that's kind of mandatory. You just give it. When it's an emergency, you'll involve steroids and different types of inhalers, but that's kind of a bit more complex. But this is kind of like a basic knowledge of asthma. You kind of know, hopefully you learned a little bit about asthma now and how to prevent it a little bit and maybe even be able to diagnose it slightly. But I hope that's been useful for you. And if there are any other questions that you have, you're obviously more than welcome to ask me. So there we are. Hopefully this is a full video, won't cut off halfway through. So there we have it. Peace.